Please welcome Professor Chiawako.
First, I would like to thank you for the invitation by University Negeri Malang, and also I also like to thank for the very nice logistic by Desi. Today, I'm going to talk about the paper that has been invited to the Canadian Journal of Physiology and Pharmacology. So if you want to have the detail of content that you can search, actually I have the paper in your hand. So if you like to see the detail of the theory, you can get into the detail by the handout. The topic of my talk today is abdominal fat reducing effect of exercise training. And is that fat burning? Is that because of the fat burning or the carbon source redistribution? So this is my talk. Can you see this well? The most important concept that I would like you to know is the from here. Half of what we know is wrong. So when we have the education at school, we always remind our students that about half of what we know in your lecture is wrong. And therefore, you want to pay more attention that the purpose of the science is to determine which half. So this is stated by a Nobel laureate in Dr. Arthur Kornberg. This is very important for before you get into the lecture. Okay. The first concept that I would like to emphasize is the fat loss does not equal to fat burning. Okay, so here I would like to define what is the fat burning. What people usually saying that fat burning is actually the conversion of the fatty acid into carbon dioxide. That is what we usually call fat burning. And do you know how to measure the rate of fat burning? It's very easy, just do gas analysis. But how do you measure the fat loss? What is the best way to measure the fat loss? In animal study, it's quite easy. You can just cut the tissues and weight on the scale. But for human, you cannot do that. So in human, the best way to do it is to use the image technique. Just for example, DEXA and MRI. So you understand that the fat loss and fat burning are measured by different ways. And you can always find that there are a lot of intervention that can actually increase fat burning, but it does not reduce fat. Okay? That has been happen all the time, especially if you are in the area of functional food. You can see a lot of functional food can increase fat burning, but cannot actually cause fat loss. So today, I would like to give some of the scientific evidence to convince you that the exercise can cause fat loss, and that is not because of the fat burning. Later. Okay. Another important concept for you to know is the fat mass is actually a balance of the fat cell death and fat cell regeneration. So if I ask you the question, how many cells in your body are dying per year? What is the scale of the fat cell death in a normal human body? That is about 10%. It has been published in 2009 in journal Nature. It has shown that the normal adult age around 30 to 40, it has about 10% of the fat cell turnover in human body. So if I ask the question, if we have 10% of the cell are dying every year, how come we still get obese? What is the reason? That most of the people has the fat accumulation over time from age 20 to age 60. Okay, let's come back to the important question. How exercise prevents abdominal fat accumulation? There are two alternative hypotheses. The first hypothesis, fat burning during and after exercise. Fat burning during and after exercise. The second hypothesis, exercise makes skeletal muscle a favorable storage site of carbon source against adipose tissues. If you really look at the scientific evidence, you found that most of the evidence support the second hypothesis, but not the first hypothesis. But if I ask you the question, which hypothesis is more popular in scientific community? The first one, yes, exactly. Then if I ask you the question, why the first hypothesis is more popular? The reason is very simple, because exercise looks like an energy-consuming behavior. And therefore, a lot of people translate this knowledge and saying that the exercise is fat burning. But if you look at all scientific evidence, there's virtually no evidence to support this fact. I will show you the evidence later. Okay, so exercise can cause fat loss, but it's not because of the fat burning. It's because of exercise make the skeletal muscle a favorable storage site of the carbon source against the adipose tissues. Okay, so let's go back to the scientific evidence on what has been discovered in the past for exercise training study. So these are the scientific evidence using the tool of MRI and DEXA to look at the effect of exercise training on fat loss. So if you look at the scale right here, okay, in the middle line here, this is 0. So if you see, and there are more than 15 different studies, if you see the point on the left means decrease VAT. The VAT means visceral adipose tissues. Okay, so if the dot is on the right, means exercise training increases VAT. Okay, and if you look at all papers or scientific evidence, you see most of the mean is located on the left of the middle line, which means exercise is consistently reduce body fat. Okay, so if you ask the question, is exercise good for fat loss? The answer is very consistent. Okay, then if you look at the detail of the study, we have on the left, we have low intensity, we have moderate intensity, and we also have the high intensity. Please tell me what intensity has the best effect on fat loss? Okay, why you say low is the best for fat loss? Okay, which one has more fat burning? Low intensity, medium intensity, and high intensity. Which one has the highest fat burning? Low, right? So a lot of people said you should go for low intensity exercise. But if you look at the evidence here, you found that low intensity has very small effect on fat loss. So the reason that a lot of people receive no benefit from exercise in fat loss is because of they are participating low exercise. And the reason the people participating low intensity exercise is actually based on the fat burning concept. Because if you look at high intensity and low intensity, which one is more anaerobic? High intensity, right? So you know that if you do high intensity intermittent exercise, you are actually consuming carbohydrate more, and the fat cannot consume because fatty acid cannot be burned under when you have no oxygen, right? So from here, it's very important. If you just look at the result, if you want to get fat loss outcome, you want to go for high intensity. And the high intensity is actually anaerobic, okay? And low and moderate intensity are more aerobic, but it's less fat loss, right? You receive fat loss less. So this is the very important point I would like to bring to you. So the fat burning concept cannot explain this result well, and therefore we need to restructure the theory. Okay, so if I ask the question, if exercise does not oxidize fat, then how do we lose fat? The answer is right here. We are actually oxidizing fat all the time. This is very simple to measure. If you measure your resting RER, you will find that most of the young people are located around 0.85. For older people, it's very close to 0.7. So what does it mean? It means we are consuming fat all the time. Okay? So let's look at next evidence. This is another evidence. This is the measurement of plasma fatty acid concentration from two different sites. If you look at the dashed line here on the left, you see the top is abdominal venous blood. So you can see that the concentration of the fatty acid is mostly diffused from adipose tissues, which is high concentration in fatty acid. So that means when we are under fasting condition, when you are not with meal, the fatty tissues, the adipose tissues, is releasing fatty acid all the time. Okay? And if you look at the underneath, the forearm blood, you can see the concentration of the fatty acid are very low. So this graph give us very important idea that the fatty acid is releasing from adipose tissues as a 24 hours routine. And skeletal muscle is a major consumer of this fatty carbon source. Okay? Then, if I ask you the question, if our adipose tissues are releasing fatty acid as a 24 hours routine, how come there are so many people still get obese? The answer is very simple. If you look at the dashed line on the right, so you can see this is a dashed line. On the right side is when you have the meal. When you have the meal, the difference between abdominal venous and forearm venous blood in fatty acid concentration is actually dropping. And that is the time when you have the fatty carbon source replenish back to your adipose tissues. Okay? So if when you have a competitor for the fatty carbon source, when you have the meal, then this fatty carbon source return to adipose tissues would be less. And therefore, you can create a negative fatty acid balance in your adipose tissues. So you are consuming fatty acid all the time, but when you replenish those carbon sources back to your adipose tissues, there's a competitor in your body, then you will not get fat back to your adipose tissues. And the major competitor for fatty carbon source in your body is skeletal muscle. Okay? This is low intensity, moderate intensity, and high intensity exercise. So as you can see, high intensity exercise has higher absolute caloric expenditure. The energy expenditure is 3 times higher compared to the 25%. This is like walking, okay? If you look at the fatty acid oxidation from adipose tissue, which needs to be mediated by the plasma fatty acid. So the plasma fatty acid would deliver the fatty acid from adipose tissues to exercise muscle. So if you look at the gray, the hatched line here, as you increase exercise intensity, what happened to the fatty acid oxidation? In absolute term, the answer is quite clear. As you increase exercise intensity, the fatty acid oxidation is decreasing, right? And which one is more effective to reduce body fat? The answer is very simple. High intensity is more effective. The low intensity walking is not going to reduce your body fat, but it has more fat burning, right? So can we say that the abdominal reducing effect of exercise training is because of fat burning? The answer is very clear. We cannot say that. Okay. Another example is high intensity intermittent exercise. So you all know high intensity intermittent exercise is aerobic, purely aerobic exercise, right? Can aerobic exercise fat burning? The answer is obviously not. Because when you have no increased oxygen consumption, then the fat cannot burn, right? Okay, so let me give you the example here. There are 3 conditions. The HIIE means high intensity intermittent exercise. The SSE is a lot of people promote it. Many people promote 60% VO2 max and at least 30 minutes exercise 3 times a week. Okay, so that is most of the people recommend. But 12 weeks later, you found the only exercise give you fat loss is HIIE. You see 60% VO2 max for 30 minutes, 3 times a day is not giving you very good effect on fat loss. So from here, you can see that if you want to use the fat burning concept to explain this phenomena in our previous slide, you will see a major conflict, right? Okay, the problem about the fat burning hypothesis is, the best way to reduce your body fat is exercise and then recover at hypoxic condition. You know, if you just send athlete to mountain, the adipose tissues would reduce dramatically. It can occur in 1 week, okay? There are many people study that area. Okay, if exercise reduce fat is mediated by the fat burning, then hypoxic condition will give you opposing effect. Because if you move someone to the mountain, you have less oxygen. Can you burn fat? You cannot, right? But let's look at here. This is the paper published by the Nanyang University, Nanyang Technical University. Okay, there's a Singapore swimming team shift from Singapore to China Altitude Centers. I don't know whether John participated in this study, maybe. Okay, but if you look at here, there's altitude, okay? So if you look at pre and post, and just pay attention on the change in the fat mass, it has 11% fat reduction in only 3 weeks when you shift the teenagers, the swimming team, from Singapore to China High Altitude Training Center, only 3 weeks. And the most interesting observation is that there's no exception. Everybody has fat loss, no exception. Okay, but if you look at the control group is the one resided in sea level. There's no change in the fat mass. So this gives us very important concept, again, that you don't want to use fat burning to explain the fat loss outcome. It would have a lot of conflict. And one of the mechanisms is because this is the total hemoglobin in the muscle. When you place someone into hypoxic condition, you will see the muscle blood distribution is going to be increased by hypoxia. So when you have more blood get into your skeletal muscle, then when you have the meal is going to deliver to skeletal muscle more. And that is the major mechanism to prevent the fuel getting into adipose tissues. Okay? Okay, how about the metabolic rate? Okay, exercise will increase metabolic rate. Everybody knows this, right? So when you see someone that exercise and in the chamber, so the best way to measure basal metabolic rate is place someone into the chamber. This is what we call indirect calorimetry. So you have seen that this is 24 hours energy expenditure. Control, no exercise. LI means low intensity. HI means high intensity with shorter period. So from here, you can see that exercise will increase the resting metabolic rate by about 500 kilocalorie. Okay. Then we ask the question, does this because of increased fat burning? Then let's look at the outcome. Okay. So this is on the right side, right upper side is 24 hours fat oxidation. This is the marker for fat burning. You can see that no exercise, low intensity, and high intensity has virtually the same fat burning rate. So this means exercise is not fat burning. But does exercise effective for fat loss? The answer is yes. So you cannot say that the fat loss is mediated by fat burning during and after exercise. So if you look at the 24 hours carbohydrate oxidation, you can see that low intensity and high intensity is increased reliance on carbohydrate. Okay, this is the concept. Okay, this is the most important one. Okay, you see here, this is the blood vessel, and blood vessel is very important place to deliver your energy substrate to adipose tissues and skeletal muscle. And it also delivers insulin, leukocyte, and stem cell. Okay? So when you have the muscle challenged by exercise, you are going to have cell damage, you have an energy depletion, then you have a phagocytosis, you have heat loss, and you are going to have a greater demand for stem cell and carbon source for cell regeneration. Okay? So when you challenge the muscle, the energy will go there, and the leukocyte and the stem cell would also go to the challenge skeletal muscle. And that would bring a lot of carbon source from your meal, and therefore you are less likely to have the fat accumulation in your adipose tissues. Please let me conclude the first. Exercise makes muscle more competitive for energy storage against adipose tissues. It's more related to redistribution of the carbon source among muscle and adipose tissues. And the scientific evidence does not favor fat burning hypothesis. Second, aerobic exercise seems to be better than aerobic exercise. Okay, so you want to pursue high intensity exercise. The meal time is important. When you start to exercise, the meal time is very important. The delay in meal will kill the fat reducing effect of exercise. And the size principle, I think most of you know the size principle. The exercise intensity is important because when you have higher intensity, you are challenging more muscle fiber. When you are recruiting more muscle fiber, you have a more competitor for the carbon source after meal against adipose tissues. The total dietary control is still important because that is where the carbon source coming from. So even you exercise, but you eat a lot, and that is not a solution for the fat loss. Okay, here I would like to conclude my presentation. Thank you for your patience.